So, welcome back, everyone. Today we're diving into Chapter 12, the integumentary system. You want to think of the skin not just as a covering, but also the body's largest organ system, a complex protective shield that interacts with every other system in the body. Integumentary does come from the Latin word integumentum, which means covering. So, by the end of the lecture, you should be able to recognize the core protective and physiological functions of the system, decode complex medical terms into their fundamental building blocks, and finally, we'll analyze clinical terms for pathological conditions, diagnostics, and interventions. So, to make the functions of the skin easy to memorize, let's look at the acronym DERMA. D for vitamin D synthesis. This is crucial for bone health and it's triggered by UV light. E stands for elimination of waste through perspiration, sweating out small amounts of metabolic waste. R stands for regulation of body temperature through perspiration and blood flow changes. And M stands for makes information about the environment available to the brain via sensory receptors. Let's trace the three primary layers from superficial to deep. First, we have the epidermis, the outermost layer. Epi means upon or above. Dermis means skin. It contains no blood vessels. Dermis, the true skin layer containing structural collagen, blood vessels, nerves, hair follicles. Subcutaneous adipose tissue, also called the hypodermis, is composed of fatty tissue that anchors the skin and insulates the body. So let's look at our toolkit. Remember to look at the vowels linking these roots. Adipo and lipo both mean fat. Think of lipomo or fatty tumor or adipose tissue. Axilla means armpit. A practical clinical term is axillary temperature. Bacteria refers to bacteria, like an bactericidal agent. Cutanoderma or dermo and dermatato all mean skin. You'll see these used interchangeably depending on historical anatomical origins. For instance, subcutaneous versus dermatology. Erythromato means erythema or redness. An example is erythematis skin. Folliculo means follicle, the tiny sac from which a hair grows. And so specialized structures, unco and ungo mean nail. For example, pilo and tricho mean hair. Pilomotor muscle moves hair. Sebo means sebum, the oily secretion produced by sebaceous glands. Sepso and septo indicate infection or contamination. Zero means dry if a patient has severe dry skin. And these words endings modify our roots. Cytal means killing or destroying. Combine it with bacteria to make bactericidal. So that's a bacterial killing, usually some type of pharmaceutical. Derm refers directly to the skin layer on an embryonic germ layer, like leucoderm. Static, meaning keeping stationary, halting, or inhibiting growth. Bacteriostatic drug doesn't kill bacteria directly, it stops them from multiplying so the immune system can catch up. So here's just a quick knowledge check. In time for a brain break. Moving on to disorders and diseases. The primary skin lesions are immediate physical reactions to an underlying health problem or disease process. Boulé is a large fluid-filled blister greater than 1 centimeter. Um, a maculae, a completely flat, discolored spot. It changes skin color but has no texture. A papule is a solid raised bump up to 1 centimeter. There's no fluid inside. A pustule is a distinct raised pocket containing pus. A vesicle is a small, clear, fluid-filled blister under 1 centimeter. So, for instance, like a chicken pox or a herpes blister. Secondary lesions happen over time. They represent a structural progression, scratching, or healing phase of a primary lesion. Atrophy is wasting away of the epidermis. The skin looks translucent and thin, like stretch marks, and that's called striate. Ulcers are deep open sores that go past the epidermis and erode into the dermis. So, for instance, pressure sores. Fissures are linear cracks or splits going straight down into the dermis. These can be incredibly painful because they expose deep nerve endings. For instance, athlete's foot. So, let's go on. Okay. So these terms are defined by the mechanism of physical injury, laceration versus incision. A laceration is a jagged tear from blunt force. An incision is a clean, intentional slice made by a sharp edge, like a scalpel. A puncture is a narrow wound caused by something pointing pierce straight through the layers. These carry a high risk of deep anaerobic infection. Abrasion is a superficial friction scraping away outer skin layers. Contusion is a bruise. The skin stays intact, but underlying capillaries break and leak blood. Keloid is an abnormal overgrowth of scar tissue that expands beyond the boundaries of the original wound. A frostbite is true tissue necrosis and damage caused by ice crystals freezing the cellular space. So let's look at pathogens causing integumentary distress. So we have cellulitis, which combines cellulo, which is cell or compartment, with itis, inflammation. This is a dangerous spreading bacterial infection within the deep dermal and subcutaneous layers. The skin will feel hot, red, and swollen. Furuncle is a localized boil. It occurs when a hair follicles becomes deeply infected with bacteria. Folliculitis is follicle. So folliculo is follicle plus itis, inflammation, a more superficial inflammation or mild infection restricted to the hair follicles. And mycodermatitis is myco, which is fungus, plus derma, skin, plus itis, inflammation. It's a fungal skin inflammation. And onychomycosis is a fungal infection of the nail. And pediculosis is an infestation of lice. So, dermatitis broadly means skin inflammation. If it is caused by touching an irritant like poison ivy, it is contact dermatitis. Um, the seborrheic dermatitis is inflammatory, scaly, greasy crust that target areas rich in sebaceous glands like the scalp. Acne vulgaris is clogged hair follicles due to overproduction of sebum, keratin, or buildup and localized bacteria. Hydrodentis is inflammation of the sweat glands, so hydro sweat, adeno gland, and itis inflammation. Urticaria is hives. This is a vascular allergic skin reaction causing temporary, intensely itchy welts. Scleroderma is an autoimmune disease where the skin becomes hard and tight. Sclera meaning hard and derma meaning skin. And psoriasis is a chronic autoimmune condition where skin cells replicate too quickly, causing raised plaques covered in distinct silvery scales. That's a tongue twister. So hydradentitis is an inflammation of the sweat glands, hydra, sweat, adrenal gland, and inflammation. I think we did these. So we'll just keep going through. So albinism is genetic lack of melanin pigment production. Hypopigmentation is localized lighter patches of skin compared to normal tone. Cyanosis is bluish tinge around the skin or mucous membranes. This is critical sign of indicating that there's poor blood oxygenation. So, ichthyosis is this is a genetic condition causing dry, scaly skin that resemble fish scales, and xerosis is standard medical term for severely dry skin. And we are going to go on. Lipoma is a benign soft tumor made of fatty tissue. Skin cancer is uncontrolled cell growth caused by mutations, often triggered by UV radiation. And malignant melanoma is the most lethal form of skin cancer and originates in the pigment producing cells of the melanocytes. Here's a knowledge check. Another knowledge check. We're going to go on to diagnostics and interventions. A biopsy is just removing a physical tissue sample from a living patient to analyze it under a microscope or abnormalities like cancer. So that is the most common use of it. Aspiration is using a suction via needle and syringe to draw out fluid or pus from a deep cavity, cyst, or abscess. So this can be used for testing or to relieve pain. So some pharmacological treatments or topical medications are applied directly to the surface of the skin for a local effect. For example, putting hydrocortisone cream right on an itchy rash. Transdermal drug delivery, trans meaning through and derma meaning skin, is applied via adhesive skin patch, but intended for systemic absorption into the bloodstream. So for instance, a nicotine patch or nitroglycerin patch. An antimicrobial, remember anti means against, is an agent that kills or inhibits microorganisms, and antiperspirants are agents designed to reduce or temporarily block the flow of perspirations from the sweat ducts. When medications aren't enough, we use procedural interventions. Cryosurgery uses cryo-cold, using extreme cold like liquid nitrogen to freeze and destroy abnormal tissues like warts. Curettage is scraping away abnormal tissue using a spoon-shaped cutting instrument. Debridement is the essential cleaning process of removing dirt, foreign bodies, or dead tissue. You'll see this used a lot with wound therapy. Dermabrasion is a mechanical scraping or braiding procedure used to smooth out surface imperfections, scars, or tattoos. And electrosurgery or electrolysis uses high frequency currents to cut tissue or control bleeding. Yeah, so just quick knowledge check. And then we have their references. Just a quick reminder to use your learning supports in the textbook or in your Google Notebook to retain this information.